Vitamin D is a type of vitamin that is vital for the human body. It is also commonly known as the sunshine vitamin because it can be synthesized by the skin when the body is exposed to sunlight. Vitamin D plays an important role in bone health by regulating the absorption of minerals such as calcium and phosphorus by the body. So, what are the symptoms of vitamin D deficiency in the body, and which one should be paid more attention to? What are the factors that cause this? How do we eliminate this deficiency? We want to give you important information that will contribute to your health. First of all, what is vitamin D deficiency? Vitamin D deficiency means that the individual does not get enough vitamin D to stay healthy. Vitamin D, whose deficiency causes severe symptoms, is used to perform different functions in the body. Vitamin D is needed to absorb calcium, one of the basic structures of bone. Vitamin D plays an important role in the functioning of the muscles of the nervous system and in keeping the immune system active. It is possible to get the amount of vitamin D the body needs in 3 ways. The first way is through the skin's own production of vitamin D. The second is through diet, and the third is through vitamin supplements. Vitamin D is synthesized naturally in the skin when exposed to sunlight. However, since overexposure to sunlight can cause premature skin aging and cancer, many people prefer other sources of intake. The body's need for vitamin D varies according to age and periods. The amount of vitamin D the body needs increases with age. Vitamin D deficiency is a common problem in society. For this reason, vitamin supplements are required for individuals to bring their blood levels to normal levels. However, it is always important to be careful in this regard and to avoid taking too much vitamin, because too high levels of vitamin D can cause various health problems, although it provides additional benefits to the body. What causes vitamin D deficiency? The answer to this question is usually not getting enough sunlight. Nutritional deficiencies and some health problems lead to deficiency. The causes of vitamin D deficiency can be the following: not getting enough sunlight. Spending too much time indoors reduces exposure to sunlight. People living in high latitudes cannot get enough sunlight throughout the year. People with darker skin color have more melanin in their skin. Melanin absorbs sunlight and reduces vitamin D production. Inadequate diet, not consuming enough vitamin D-rich foods such as oily fish, egg yolk fortified dairy products lead to vitamin D deficiency. Kidney and liver diseases, these organs play a role in converting vitamin D into its active form. Kidney or liver dysfunctions negatively affect this process, leading to a deficiency. Genetic factors. Certain genetic conditions can affect the body's metabolism of vitamin D, leading to a deficiency. Obesity. Body fat can store vitamin D. However, this storage process can reduce the amount of vitamin D in circulation. These factors can negatively affect vitamin D levels. For this reason, vitamin D levels should be monitored with regular health checks, and supplements should be taken with the recommendation of a doctor when necessary. Now let's talk about the symptoms of vitamin D deficiency. Please pay close attention to the details because we want to provide you with important information. Symptoms of vitamin D deficiency include symptoms such as bone and muscle pain, fatigue, weakness in the immune system, hair loss, and skin problems. Symptoms of vitamin D deficiency are generally as follows: bone and muscle aches, fatigue and weakness, immune system weakness, hair loss and skin problems, tooth and gum problems, depression, and mental disorders. Yes, now we are going into detail. Bone and muscle pain. Vitamin D is essential for the body's bone health and muscle function. Low levels of vitamin D can lead to muscle loss, muscle weakness, and muscle pain. Bones become weaker. Bone density decreases and they become weaker. Problems such as bone softening occur. As muscle mass and strength weaken, the risk of falling may increase. People with vitamin D deficiency may experience pain in the lower back. Fatigue and weakness. Chronic fatigue and weakness are associated with low vitamin D levels. Individuals with insufficient vitamin D have low energy. Persistent fatigue may occur. Low energy levels can make daily activities more difficult and reduce overall quality of life. Immune system weakness. Vitamin D can regulate the innate and adaptive immune response. Vitamin D deficiency is associated with increased autoimmunity and increased susceptibility to infection. When vitamin D is deficient, the immune system can be weakened, and you are more susceptible to persistent illness. Vitamin D was used before the advent of effective antibiotics. Patients were sent to sanatoriums to treat infections such as tuberculosis. In these sanatoriums, they were exposed to sunlight, which was thought to destroy the disease. Cod liver oil, a rich source of vitamin D, was used to increase protection against infections. Another symptom is hair loss and skin problems. Vitamin D deficiency, which negatively affects the growth of hair follicles, leads to a decrease in hair growth and premature loss of existing hair. Low vitamin D levels can lead to a different common hair loss disease known as male pattern baldness or female pattern hair loss. A disease called alopecia areata can also occur. This is an autoimmune condition in which the immune system mistakenly attacks the hair follicles. Vitamin D plays a role in the formation of new hair follicles. New follicles help to maintain the thickness of the hair and prevent premature loss of existing hair. Therefore, getting enough vitamin D can promote hair growth and strengthening. Another symptom is tooth and gum problems. Teeth are mineralized organs. They are formed by 3 different hard tissues surrounded by alveolar bone. These tissues are enamel, dentin, and cementum. The mineralization process of the teeth occurs in parallel with the mineralization of the skeleton. When mineral metabolism is disturbed, deterioration of dental tissue can occur as well as bone tissue. When vitamin D is deficient, defective teeth with poor mineralization, known as rachitic teeth, can develop. These teeth can be prone to fracture and decay. Another important symptom is depression and mental disorders. Vitamin D has immunomodulatory, neuroprotective, and neurotrophic properties. Symptoms of depression and other mental disorders may increase in vitamin D deficiency. Although some studies suggest that vitamin D deficiency increases symptoms of depression and anxiety, conclusive evidence proving this relationship has not yet been established. The most important source of vitamin D that the body needs is the sun's rays. Apart from that, oily fish such as salmon, mackerel, and sardines, red meat and liver, chicken liver, egg yolks, milk and dairy products such as cheese and butter, parsley, stinging nettles, and breakfast cereals are foods that can provide vitamin D. Yes, it is good to go out into the sunlight in the morning and afternoon hours, as prolonged exposure to the midday sun on hot summer days can have negative effects. The need for sunlight may vary depending on the skin color, age, and sunbathing pattern of the person. People with darker skin color need longer sunlight, especially in winter months, in order for sufficient vitamin D to form in the skin. Please do not forget to like and share our video and subscribe to our channel by commenting so that our video can benefit others. We wish you all a healthy and happy life. Goodbye.